webinars are made possible thanks to generous donor support. If you'd like to contribute, please visit our website, autism.org.
My name is Carrie Cuomo. I am a nurse practitioner at Cleveland Clinic, the director of APRN practice, and my partner is Julie Corder. She is a nurse practitioner in the Pediatric Complex Care Clinic, also at the Cleveland Clinic Children's Hospital. So today, Julie and I would love to talk to you about transitioning from a pediatric model of care to an adult model of care for your young adults. Here's our learning objectives, and by the end of the session, we will touch upon all of these. We want to bring the attention to transition. We recognize that transitioning from adolescence to young adulthood is a time of huge change. It marks the end of your secondary education. It changes the legal status of the child. There's obviously physical changes, and it begins new responsibilities and different social roles than the young adult has ever had. The transition period is often very confusing to those who are going through it and those who are caring for them as they go through it. Those individuals who have some sort of disability and special health care needs have a harder time during this transition period because the changes in eligibility for support services pose unique challenges. Individuals on the autism spectrum are particularly vulnerable during these transitions because of the core symptoms of the disorder and the lack of available resources for support through transition into adulthood. So the National Survey of Children with Special Healthcare Needs, this was from the data from 2019-2020, and it shows just how great the need for more focus on transition planning is for all youth, but especially those with special healthcare needs. Youth with autism are not receiving transition services at the same rate as their peers. Only 21% of youth with autism have received services for healthcare transition. And youth with autism are in particular need of a continuous, comprehensive healthcare at a medical home, at one place where everything can be coordinated all together, and they know who to contact, and the providers become very familiar with the individual and the caregivers. Some just brief statistics about this population. Every year, there is approximately 50,000 youth with autism who are turning 18. 50% of those have a co-occurring medical condition. 60% of all 15 to 17-year-old youth with autism have at least 2 medical conditions in addition to the autism. The co-occurring conditions very often include intellectual disability, mental health conditions, ADHD, epilepsy, and many others. Better healthcare transition and more comprehensive healthcare through the young adulthood has the potential to improve their health outcomes well into adulthood. It keeps them tuned into the medical system and keeps that care continuing on an ongoing basis, so there's no gaps in it. The healthcare providers need to ensure engagement for these young adults and families as they navigate the changes in their model of care. Universally, nationally, we as a healthcare system have not done that well, and that is one of the projects that Julie and I are involved in at the Cleveland Clinic, is to try to improve this for all individuals. So this is a definition from gottransition.org. We're going to be talking about GotTransition a lot throughout this talk. It's our go-to source for all things transition. Really, we need you to understand that transition's a process. It's not a quick thing. It takes many years. The true definition is that healthcare transition, or HCT, is a process of moving from a child and family-centered model of care to an adult or individual patient-centered model of care. With or without transferring to a new clinician, it involves planning, transfer, and integration into an adult-centered healthcare. So not everybody's journey is the same as you think about transition. Individuals have different needs, the families have different needs, and all of those individual items will need to be planned for with the input from the family, the patient, and the caregiver at the time. Many of the medical conditions that they've been dealing with as a child will persist into adulthood, and then several of these adolescents will have new onset adult problems that make it more appropriate for them to be in an adult setting. And we'll talk about some of the hesitancy to transfer further on in the talk, but that's one of the important things to recognize, is that as any individual gets older, there are age-based experts who are more apt to take care of those things as they continue into their adulthood. So it takes time. I think I've said it 10 times already, and I'm going to keep saying it. It's a very long process. It's a very individualized process. These are some quotes from some families that we've worked with, and I'm sure many of you can relate to them. Healthcare transitions easy to put off to a later date. I'm just going to put it on the back burner. I'll wait until our pediatrician can't see them any longer. That a lot of times that comes up very suddenly, and not only the patient, families are kind of surprised and stunned when somebody says, "Oh wait, you're 21, I can't see you anymore." How many of us have so many other things going on that it's not the immediate center of your attention? And I'll just wait for someone else to find a new adult physician for us. And the bottom one is, again, to the hesitancy. I don't want to make the change, so if I don't look for it, then I maybe won't have to do it. We all do better, though, when life is structured and predictable, especially for any of our family members or patients with autism. Procrastination and avoidance only leads to unplanned and unanticipated outcomes, and those are likely to result in an unwelcome or uncomfortable situation. So we really want to do the planning up front. I'm going to say it again. Transition takes time. It takes a long time. The transition process begins with preparing the young adult for this transfer to adult care. Transition does not equal transfer. They're two different words, and a lot of times people get those confused, both on the patient care center focus and then the provider focus. We as providers don't all understand that it's a different process of transition versus the actual transferring to a new provider. Everybody can participate, but obviously providers, family members need to make adjustments if there's some developmental delay in the patient that they're working towards transition. Plan, and plan some more. It's never too early or too late to begin. We at the Cleveland Clinic, and because of Got Transitions recommendations, will begin talking to individual patients at about age 12. Now, we're not saying you have to find a new provider at age 12. What we are saying to those patients and families is, we're going to start talking about it. We know you can't stay here forever. We know that we want to help you through this process. Let's start talking about it. What are some of your needs? What are some of your knowledge gaps? And how can we do a better job preparing you for when this change has to come? We'd like to encourage everybody to celebrate the small victories, the health accomplishments, hopes, dreams that are realized by the young adult. Transition for typical as well as medically complex patients and families with or without ID or developmental disabilities. It's daunting. It's very emotional. I will probably reference my own journey from time to time. I have an 18-year-old who has just begun to go through the adult process with my chart and all of those changes, and it's been hard, and this is what I do for a living. But procrastination and lack of planning will never help. It will never help. And the more you can talk about it and think about things before they happen, the better everybody will be. So GOT Transition. GOT Transition is a federally funded national resource center on healthcare transition. The aim of GOT Transition is to improve the transition from pediatric model of care to an adult model of care through the use of evidence-driven strategies for clinicians and other healthcare professionals. They have resources for healthcare professionals, public health programs, payers, insurance companies, families, and individual youth and young adults. Not everybody's journey is the same, and planning for primary as well as specialty care transition is very important, and all youth can participate in the transition journey, but adjustments may need to be made for age and developmental level. Part of transition planning for a youth with a chronic medical condition includes looking to identify what conditions need those ongoing subspecialty cares with a subspecialist. Some adult providers, as you get into internal medicine and family medicine providers, actually manage some of the things that we're used to managing on the pediatric side. So if you, I'm just throwing this as an example, have diabetes as a child, you will see a pediatric endocrinologist. But a lot of times when you find your way to an internal medicine or family medicine provider, they manage diabetes for their patients. And so that might be one less subspecialist that you need to see as you make that transition to an adult model of care. There's many ways to approach transition. Some patients and families want to transition all of their subspecialists first and keep that primary care physician the same until the very last minute. Some families decide the opposite. They want to transition their primary care specialist first and then one by one transfer over all their subspecialists. It's really individually based, and conversations with the family and the youth and the provider all together is how you'd go about deciding those things. There really is no right or wrong way. Many of our patients have done it both ways and they've been successful. The key is talking and open communication. We encourage everybody to go to gottransition.org. There are tools for providers. There are tools for researchers. There are tools for families. There's tools for the young adults. Every time Julie and I go to that website, we find more information and more things that we'll call each other and say, did you see this? This one's new. It's just a treasure trove of information for this population. So one of the key components of GOT Transition is these 6 core elements, they call them. They're the 6 steps of transition. What they suggest that is, if we go through these 6 steps with an individual, on the back end, at the end of them, they will have a more successful process or journey through this process than they would have if we just say, oh, surprise, you're 21, we can't see you anymore. So the step 1 is receiving a policy. The Cleveland Clinic has developed a policy that says we're going to help you through this. We're going to begin talking about it at age 12 to 14. We're going to be planning with you. Step 2 is tracking and monitoring of this process. So we, as providers, keep track of individual patients and their ages and where they are throughout the process. And we bring attention to the office and we say, this person's doing this today and we need to work towards this. Step 3 is something called transition readiness. And we use, I'm going to show you in a slide or two, the transition readiness assessment. It's a questionnaire that we send out through MyChart, and it asks questions for the young adult, and there's also a version for the parents to fill out, so that we can really identify where their learning needs are, what their goals are, some areas of focus that we can look to for the next appointment, and really individualize their plan of care so that we can create the best journey for them. Transition planning is what I just mentioned, developing that plan of care. So we take all of the knowledge gaps that we identify and we work together and form some goals for them to work on before their next appointment. The transfer of care. if they're going to see a new provider, if they've had a pediatrician for their primary care provider and they're going to now have a family medicine or an internal medicine provider, this is where they actually meet the new person. So it's not until step 5 of this whole process that they actually change providers. And then step 6 is a transfer completion. We really look for feedback from both the adult provider that they've gone to and the individual to say, did we do a good job? Where did we miss? What can we do better? And we always want to keep those lines of communication open between the adult provider and the pediatric provider in case there are questions or concerns. One example of a resource that Got Transition has on their website is this quiz. There's a link in the slides. You'll all have them. It's the handouts. And this is for a young adult. They can go through this little quiz and figure out if they are ready for transition, and it asks questions about, are you ready? Are you interested in it? Do you know your health information? Do you know your health history? And it goes through and it tells them yay or nay. You're on your way, or you need to do a little bit more planning. And this is the example of the readiness transition readiness assessment that I was referencing. An important way to prepare and plan for the transition to the adult medical world is to identify the individual's own knowledge gaps. This assessment was developed by Got Transition, and it helps the adult, the young adult and their caregivers to see what learning needs the individual might have. We, as I said, made this into an electronic version where we can send it through MyChart, so all patients and caregivers can do it on their own time frame, and then the provider gets the results sent back to them so we can review it at their next appointment. So now I'll turn it over to Julie.
Thank you. Hi. We really are very appreciative of spending this time together with you today to try to share some information about transition. And what I'd like to do, I've noticed a couple of questions in the chat about, when do you start? How long does it take? And we're going to go through some ages and stages for healthcare, kind of a timeline to, and it's not that all these things need to be done during this year of age, or whether you're 12 to 14 or if you're 16, but it kind of gives you an idea of where to start and what comes next. As Carrie mentioned, at the clinic, we start talking about transition and introducing the concept to kids and their families at 12 years of age. Not to say, we're not going to take care of you after this, so we have to worry about this, but to give them an idea of what to anticipate, and knowing that it's a process that takes years, and we're going to be there with you every step of the way. Some of the things that a 12 to 14-year-old, we would encourage them to do is to help them learn a little bit more about their health conditions, if they take any medications or if they have any allergies, and also having some time and using their own voice to speak and communicate with their provider during the appointment, not just relying on their parents to speak for them. You can also ask at this time of your provider, how long will you be willing to take care of my child, and are you going to help us, make that next step to the adult provider? If your child uses some type of communication assistive technology, make sure you bring it to the appointment so that they can also use that technology and be able to participate and speak during that appointment. Next slide. Some of the goals that we might establish at this age would be to that the youth will communicate directly with the provider for a portion of the visit, and that they're also going to come to that visit prepared. Do they have any questions? Do they have any concerns or things that they want to talk about? And oftentimes I know that when I myself, when I go into a visit, I may have all these things on my mind that I want to address and talk about, and then once I get in there, my mind goes blank. So encouraging them to write them down, and even write down the responses so that later on you can have a conversation about what took place during that visit. The IEP is also a great tool and a great place for adding healthcare skills And if your child does have an IEP, you can ask the school, since they spend a greater amount of time at school than they do with their healthcare providers, you know, can we start to work on some of these things so that my child can be more independent and autonomous in managing their care? If they're diabetic, you know, helping them participate in checking their blood sugars, interpreting the results, and discussing what the next steps are. Again, all of those things can be included in the IEP, and that's another way to support success and moving forward with healthcare skills. Next slide. When the kids start to turn teenagers, 14 to 16 years of age, this is when, as Carrie mentioned, we've tried to, on an annual basis, get the parent and the youth to complete a GOT transition readiness assessment and to discuss those responses from that checklist or questionnaire with the provider during the visit. It gives you some ideas on maybe some gaps in your knowledge that you or your child may have. It also gives you a great opportunity to compare your responses to your child's responses. Sometimes the kids think that they have a better working knowledge of things than their parents do. And so having those differences of opinion is also a great conversation to have with your provider. Help your teen practice making a doctor's appointment and refilling medications, whether that be online or through a phone app, or our health system uses an electronic medical record called Epic, and we have MyChart. And navigating those things, the earlier you can kind of get used to it, and I think youth probably adapt to that a little bit easier than some of the older folks. They seem to be pretty adept at enhancing or embracing technology in their healthcare. And also encourage, again, some portion of the visit occur with just the provider. I will ask my patients' parents to step out of the room for just a short period, explaining that I'm just going to, you know, give your child an opportunity to ask me a question that they may want to do in confidence. And also it gives me an opportunity to just kind of get a better rapport and establish a better relationship with that young adult when we have some one-on-one time. Next slide. Again, goals for this age group. This is this first suggestion, summarizing your health history in 3 sentences or less, was a suggestion that Carrie and I heard during one of our meetings where we're on with a number of groups throughout the country that are addressing transition. And oftentimes these kids, especially my population, which are patients with medical complexity and multiple medical, chronic medical conditions, there's a lot that is going on in their life. But if they can practice and create a brief summary of who they are and what they're about and what kinds of things are important to them, and practice it when they're not in a healthcare setting, it oftentimes is a great icebreaker for them to be able to facilitate that conversation with their provider or a new provider. At this age, getting to know what their medicines are, if they take any, and what they are for. Also, assuming some responsibility and autonomy and remembering when they are due. Not that they need to be completely independent in taking their own medications, but if you know that you take something at 5 o'clock, having the youth set an alarm and come to the parent saying, "Hey, Mom, it's time for my medicine," as opposed to the parent having to chase the young adult down. And also goals, again, of seeing the provider alone for a part of the visit, and also talking with their parents or guardians about the transition process and maybe some questions that they might have. And again, including things in the IEP as another source of support. At age 16 to 17 is when, especially for my population, we start to have some conversations about what that young adult's future is going to look like. Are they going to be able to live independently? Are they going to be going off to college? Are they going to need to live with their parent and rely on their parent to make their medical decisions for them? All of those types of conversations are better had earlier as opposed to later, so that you have some time to plan. we are very blessed in having legal aid representatives on site at our clinic site, and referring to our attorney advisors for help with determining guardianship, or whether a power of attorney might be necessary for a portion of time, or even for an extended portion of time. Maybe that young adult might be able to be independent in their health care, but they might need some oversight in financial planning and financial matters. So there's a variety of options and a variety of situations that, if we have opportunity to discuss them earlier on, as opposed to scrambling to make a decision, it allows for those conversations to occur in a thoughtful process, and also to maybe pull in some other subspecialists to help guide in that decision making. A health passport or an online portal, we use, as I mentioned, MyChart. Again, working with your young adult to explore that portal, get them used to navigating it, and also talking with them about how they want to keep their information. Most young adults do have a cell phone, or their parents or guardians have cell phones, and so having something available on an app is oftentimes very helpful. Next slide. So goals for the 16 to 17-year-old include knowing how to ask questions, and also how to say, wait a minute, I don't understand what you said. Can you repeat that, or can you rephrase that? Again, having, if possible, the patient or young adult talk with the provider as opposed to the parent or guardian. If assistive communication devices are needed, bringing those to the appointments, allowing a portion of that appointment to be with the young adult and the provider alone. And also talking about how you can access care. Do you know how to reach your doctor's office, and what to do if it's a weekend or an evening when that office might be closed? Next slide. So 18 is a big, is a pivotal age for patients in the United States. Our young adults may not look or feel any different, and our parents may not feel that they are any different, but legally they are viewed as adults. What that means is that they are responsible and independent in managing all of their decisions, healthcare, giving consent for surgeries, and that after 18, there is confidential information that we're no longer able to share and communicate with their parent about. And they may be, young adults and parents alike, may be used to being very involved in their medical decision-making for that young adult. However, without a permission or a release of information from that 18-year-old, we're not able to communicate with parents. So planning for this birthday before the birthday occurs is very important. Again, determining what type of abilities your team might have, whether they might benefit from some shared medical decision-making, power of attorney, or even guardianship. And making those decisions is tough, and we want to make sure that we're not being limiting, and we want to allow them to be as independent as possible, but with the supports that they need. Oftentimes, neuropsychology or some of our behavioral health colleagues can help with managing this decision and what's best also. Next slide. Goals for the 18-year-old are knowing how to get a summary of or access my medical information from a portal, how to make and cancel appointments, how to get to appointments, how to ask for a referral if maybe there's something else going on that I have a question about, and making sure that you maintain your medications and what you need to do to ensure that you have the insurance coverage also to pay for that equipment and supplies. One of my patients that I cared for was a young lady who had received a kidney transplant, and part of her transition plan as she was getting ready to graduate from high school and go off to college was to make sure that she knew how to use that portal to communicate with us and vice versa. And we also had a conversation with the health center at her college, because we assumed that, you know, if she needed to go somewhere locally to be seen, it would be with that provider at the health center. And we wanted to make sure that they knew how to reach us and we knew how to reach them. Again, these goals are for young adults who will be assuming responsibility for all of these aspects of their care. If they don't have the abilities to do these things, then we need to identify somebody else who can be of assistance and has the authority to help them with those areas. Next slide. This is another example of a great document that's available on the Got Transition website, and it is a sample plan of care. And what it includes are goals that are prioritized by the young adult, what types of issues or concerns and information needs to happen before that young adult transitions to adult care, and who's going to be responsible for meeting those gaps or needs. This is all of their documents are meant to be printed, used, dispersed, and disseminated amongst others. And they really want you to individualize and use their tools. Next slide. These are, again, sample documents that can be used with transition. The first is a transfer of care checklist, so that you make sure that you've got all of the information needed to set yourself up for success when you do go to a new provider. And on the right is a sample of a transfer letter. Some patients may be going to a private physician or a nurse practitioner in a private practice not affiliated with a major medical center, and they may not have access to a lot of supports throughout an electronic medical record system. These can be printed, individualized, and utilized as a paper source of information. And if your provider says, you know, I don't know how to write these letters, I don't have access to them, you can actually bring the template in with you and ask them to complete it, so that information is captured. Next slide. This is a very full and busy slide, but these are some of the resources that I have really found to be great and give awesome recommendations. The first one that we have there is Got Transition. There's actually, they have a really robust search function on their site. So if you get to their website, and there's new information that pops up there every day. But if you use the search, the magnifying glass icon, and type in toolkit, they have really enhanced it so that it'll take you directly to that link, so that you'll be able to find these resources. The National Resource Center for Supported Decision Making is a great support and information source for trying to figure out how to best allow for as much independence as possible for your child or young adult, while also supporting them and ensuring that they maintain their highest level of health. The Autism Research Institute, I was taking a look. There's a number of other recorded webinars that are on there that were great, that I enjoyed viewing. Milestones also has a tool called the Milestones Autism Planning Tool. This is a really neat tool that you can use, and it actually starts at age 0 to 6 years of age and starts building on the social skills, knowledge, and adding to those skills as one progresses in age. So they're using a lot of social skills and a lot of other planning tools to build from a very early age. Autism Speaks also has a transition toolkit, as does the Child Neurology Foundation, for those young adults that may have autism in addition to epilepsy or another co-occurring condition. And then finally, Family Voices. And in a couple of slides, I have some specific pictures of some of their resources. We in Ohio have a group called Ohio Family to Family, and it is a grant-funded project. The funding is through Maternal and Child Health Bureau, and the support specialists are parents of young adults with medical complexity and special health care needs. Amy Clausen is our resource, and this is her contact information. We are able to benefit from their offerings. They have what they call transition boot camp sessions that talk about a variety of topics such as guardianship, supported decision making, independent living. It's a great resource for folks that is available virtually, and it is free. I'm not sure I see there's a lot of people from even outside the country that are here. But if you reach out to Amy, I know that she might be able to at least guide you to, if there is a support service specialist within your state, or just a link to the Ohio program so that you can participate in those if you'd like. Next slide. Charting the Life course is another transition toolkit. It's a 4-page toolkit that also gives you some ideas on what some of the steps are with transition, and this is the link for that. Next one. And finally, a lot of people are really find difficulty in locating and feeling that they've located the appropriate adult provider for their child or for themselves. And one of the couple of the suggestions that I have given some of my patients is, ask your current provider who they would recommend. They probably will know someone either within the health system or in the community that might be a good fit for you. Or if you're the mother of a young adult who's transitioning to adult care, ask your own provider, would you be willing to see my child and accept them into your practice? And they probably heard you speak of your child and maybe some of the concerns that you might have. And that might be a great fit too. It's somebody that you already have a relationship with and a trust with that would help to facilitate a smooth transition. If you go to major hospital systems, if you're are able to, if there are some within your geographic area, find out if they have any transition consult clinics. We're working on this at the Cleveland Clinic now and trying to help facilitate and support our other providers in the system in getting care for their patients who are starting to age into adulthood. Again, contacting your case manager through your insurance, your county board of developmental disabilities, and also networking with other family support groups and state networks are also great ways to find out about possible providers. Next slide. Family Voices, I mentioned earlier, and this is a great resource. One of the positive things that COVID did for this country, I feel, is that we really started to embrace telehealth. We started thinking creatively of how we can take care of our patients that outside of the four walls of our clinic space. And telehealth, I think, has been a real positive change for many aspects in healthcare. One of the things that we are starting to employ is a telehealth transition visit. And Family Voices has a couple of great resources. This is a social story with some pictures and descriptions. And then the next slide, we're going to switch over and ask Denise to show you a brief clip from this video. This is on the Family Voices website also, and it is on how to navigate a transition telehealth visit where the pediatric and the accepting adult provider, as well as the patient and family, are all able to meet together, similar to the way that we're meeting together right now, where a warm handoff from the pediatric provider can be given to the adult provider in front of the patient and their family so that they have the reassurance that that new provider is getting to know my child and what they're all about. And it also allows for some bidirectional communication between the two.
Healthcare transition, or HCT, is about moving to an adult model of care where you are the main person making decisions about your health. For many youth and young adults, this can be a challenging process. HCT is not a single event. It's a process that usually takes several years to accomplish. One major part of HCT is learning to manage your own health and healthcare. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages 18 and 22. Turning 18 also means your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential, but you can decide if you want your parents to see your records or be in the doctor's appointment with you. In our new virtual world full of telehealth doctor appointments, how can we make the transition to adult healthcare smoother? Having a joint telehealth visit could be a good place to start, especially if you have a chronic condition. This is a virtual meet and greet appointment that can help prepare you for your transition to a new adult doctor. Let's walk through how a joint telehealth visit might work. A joint telehealth visit includes you, your pediatrician, and new adult doctor, as well as your parent or caregiver if you wish. During the joint telehealth visit, your pediatric doctor will introduce you to your new doctor. Your pediatric doctor will also share some important medical information about you with your new adult doctor. The visit is a chance for you to meet with your new doctor before you go to your first medical appointment. During the joint telehealth visit, you can also ask your new doctor questions about concerns you have. It can be a good idea to prep some questions beforehand. So here are some examples of questions you may ask.
How do I get to your office? What should I bring? Is your office accessible? Do you have my up-to-date medical summary? How do I schedule an appointment? How do I reach you if I have questions or a health emergency? Can my caregiver join for some? It can also be a great opportunity for your new adult doctor to start to get to know you. Feel free to share some fun or important information about yourself that you want your new doctor to know before your first visit with them. Here are some examples that you could share with your new doctor. Something you enjoy, like sports or drawing. Something about your medical history. Something about your preferred communication style and capabilities. Something you are worried about at the new office, like blood tests. Who else would you like to be involved in your healthcare, such as your parents/caregivers? After this joint telehealth visit, work with your new adult doctor's office to set up your first appointment with your new adult doctor. So why is the joint telehealth visit a helpful part of your transition to an adult doctor? A joint telehealth visit is a chance to get to know your new doctor, ask questions about their office and how it works, build trust with your new adult doctor, share your story, self-advocate for your health needs.
Healthcare transition is all about taking charge of your health and feeling empowered. So go for it. Speak up during your doctor's appointments, and if you need your parent or caregiver's help, ask them. It is important to feel comfortable during this process. And when you advocate for yourself, the transition to adult care will make the change easier and an overall better experience. Got Transition is a program of the National Alliance to Advance Adolescent Health and is funded through a cooperative agreement from the Federal Maternal and Child Health Bureau, Health Resources and Services Administration. This program is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services, HHS, as part of an award totaling $1 million with 0% financed with non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government. For more information, please visit hrsa.gov.
we've given you a lot of information. I guess what I'd like to, again, thank you for allowing us to come and speak and have this opportunity to try to talk about a subject that I think is challenging and emotional. And as Carrie mentioned, I've been the parent with my kids are in their 20s now, but it's a different experience for just about everybody. And there's all kinds of different ways that we can help our young adults to succeed. One of the things we'd like you to do is to think about preparing for your next visit with your provider and thinking about what that goal is going to be to help promote some self-advocacy, independence. And it's important to just start somewhere. I think I saw one of the questions in the chat about, when should you start? And it's, as we said, it's never too early and it's never too late. This is hopefully going to give you some ideas on how to progress and different topics to bring up with your young adult and where to go. And this, I would like to close with this quote. It's one of my patients, Thomas, and his mom. And his mom was very anxious about transitioning to an adult provider. And we worked together. We took a few years to do it. We identified the different subspecialists that Thomas would need. We transitioned those to the adult subspecialty side first, and then finally with her primary care doc. And she's had a positive experience and has been willing also to graciously work with us to help us navigate and create a transition program at the Cleveland Clinic so that we ensure we have the patient and the parent voice also when we're making these critical decisions. I guess we can open it up for any questions that you guys may have.
Yes, there are quite a few questions. So I will read these to you. So the first question that we have here, it has to do specifically with coverage where they are living, but they're wondering about how to help their loved one navigate the insurance side of things for that process. It's for a mammogram, so it's the first mammogram this person's gone through as well. So you might talk a little bit about that, what that experience can be like for people who have sensory differences, and then just what you've seen people do to successfully make sure that those things are covered, particularly when there's a patient who can't self-advocate.
With our complex care program, we are also blessed that we have nurse care coordinators who have been great supports for us that help to advocate and try to help us navigate through some of those issues. I think that providing information to the insurance company to help them understand that the screening needs to take place, but it might not be something that can be done safely or without some type of trauma afterwards, both emotionally and possibly physically to that young adult, to see if you can maybe speak with a case manager or someone at the insurance to try to explain the situation. Sometimes peer-to-peer conversations between providers can be helpful. And then lastly, some of the things that for my population who oftentimes are not able to understand, and it can be challenging for dental care or for other procedures, we try to work to see if something does need to be done, such as dental care under anesthesia, to try to coordinate things under that same exposure of anesthesia. So we've got a number of things that are occurring at the same time so that those health checks can be done with that patient and be done safely.
So you talk a little bit about I won't ask you to explain the difference between guardianship and power of attorney, but this person had an experience where they had gone with their loved one who's an adult to an appointment, and the medical office wasn't quite sure how to handle power of attorney. So I would guess that's not a common problem at the Cleveland Clinic, but do you have advice for parents if they're trying to educate their own clinicians about what that means and how to use it?
Sure. I think what I would first use as a resource is possibly your county board of DD. Oftentimes their support administrator is somebody who will have a great working knowledge of power of attorney versus guardianship, and also some of the ways to navigate the system so that, again, we're being able to be supportive and not restrictive. And I'm sorry that you had that experience, because I think everybody needs some level of support, and sometimes it changes over time, sometimes it doesn't. And being able to share your concerns and also feel as if you've been supported in those decisions is very important. But I believe, since you mentioned, Denise, that this is already an adult patient, yeah. So I think the board of DD would be an option. The other might be asking for a neuropsych eval. Sometimes getting some objective and validated testing done to show where somebody's understanding and where their levels of autonomy might lie are also places. If you could ask for a referral to a psychologist for that type of testing, that might be helpful.
Son actually transitioned from being a teenager to an adult during COVID. And so they are struggling with finding resources. Typically, they would have done the HCT process, but because this all sort of happened in this vortex, and now they're having a hard time just getting appointments. So have you seen any of that in your facility, or do you have any thoughts about how they might try to navigate that in this short term?
Yeah, we have difficulty with it even within the Cleveland Clinic. And, you know, you look at it from an outside viewpoint, we have pediatrics and we have adults, and we should be able to make a seamless process. The one thing we have done in the past year is developed an actual order that can go into the computer system so that the primary care or subspecialty pediatric individuals can push a button and it says consult to primary care, and it's an actual order that goes to a scheduler that then helps the patient and family get an appointment with a new provider. A scheduler will call the family and say, hey, we've got this order. Who do you want to see? What location are you interested in? Or would you like a male or a female provider? And they're really helping to navigate the system. I do know that some insurance companies have navigators that help with that. So I would encourage them to reach out to the insurance company and ask. And, you know, social workers are also very adept at navigating the system. And part of our new transition consult clinic that Julie made reference to, we have a team and care coordinator and social work. They're huge components of that, and they help bring out all the pieces together.
Okay, this is a parent who's describing, I've got one more COVID related question here, COVID anxiety. So their loved one on the spectrum does not want to go to appointments, feels like the doctor's office is a place where they will get COVID, and that there's fear about that. I know, at least where I live, we still wear masks at medical appointments. So maybe that's a strategy, but maybe you could talk a little bit about that, or if you've seen any of that kind of anxiety, even in just typical patients.
Yeah, I think COVID brought on a lot of challenges for many of us, and anxiety in going into healthcare settings is one that we are hearing a lot about, and people are hesitant to go back into the office. We at the clinic are still wearing masks, and I believe the majority of healthcare organizations within our city are still having providers mask, and we're asking our patients and family members to mask also. We've loosened up on the visitation restrictions. I think that if a virtual visit can be arranged with that patient and their provider, I'm sorry, Denise, did you say they had already then needed to go to a new provider also? They transitioned during this? No, okay. Because that would be, I mean, if it's somebody that they could see virtually and to have that provider offer some reassurances about things that they're doing in the office to try to reduce the risk and exposure to COVID. And, you know, we've got rooms over here that we're seeing our sick patients in for our well visits. We have you coming in this way. We're going to get you right in a room. And I think if that patient has a relationship with that provider, they might be able to provide some reassurance and for coming back into the office. Some things can be done without coming into the office, and a lot of times that's insurance driven. Right now in Ohio, we're not allowed to, or we're not reimbursed for well visits that are done via telehealth. We were, but then as things with COVID have changed, they've kind of backed off. They, meaning third-party payers, are no longer covering that. But trying to maybe have a short visit to address one certain issue might be helpful to get that trust and the decrease the feelings of anxiety and coming back to the doctor's office. Carrie, did you have any other suggestions?
No, the telemedicine first and meet with the individual and then going into it slowly, I think is the best approach.
Okay, I know you addressed this a bit in the talk, but maybe you could review it a little. Strategies that you've piloted for young adults who have lower cognition abilities or who may not be able to answer transition questions verbally. So could you review a little bit about that, how to help those individuals?
There is a readiness assessment on GOT transition that is geared for young adults with intellectual and developmental disabilities. And instead of, it can be completed with the parent, helping them and identifying areas in which they can be independent and maybe areas in which they're going to need some support and who would provide that support for them. There's also, I think, a question about someone who is nonverbal and communicates using yes/no answers, but isn't always accurate in the answers that they give. I think communication, we try to communicate and include our patients as much as possible. And I have a young patient who's actually 18, and I do see him independently, but I also see him with his mom in the room, and his mom will oftentimes sit behind him and give me yes and no kind of head nods with regard to answers to my questions. If I ask him, are you doing blah, 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 and how's this going? And he'll answer me one way. And it's kind of a nonverbal from her that might not be the most accurate answer. And then we explore that a little bit further with her offering some more information, trying to just engage that young adult as much as possible while also ensuring that we are getting accurate information from the parent. It may be a situation where the parent steps out for a little while and then we kind of summarize what our conversation kind of took place while that parent was out of the room, so that we're all on the same page and we know that the information that we're sharing is accurate.
Okay, this is a question, I know we need to wrap up, we just have a couple more, but this is one I hadn't seen before. It was emailed to me. This person works in a medical office, and they have been a couple of times in a situation where the patient clearly needed support, but because the patient was an adult, they weren't sure if they should invite the parent in or not. There's no power of attorney on file. Is it okay if there's verbal consent to ask the parent to come in, or is that not okay? Do you have any insight you can share about that?
I don't know the official legal rules, and I don't know if Julie does either, but I mean, just if they are able to say, would you like this person who's with you to come into the appointment? Yeah, you can verbally do that, and that's okay.
Okay.
You don't have to have a written document to say, this person that came with you, is it okay for them to be in here? That's okay to do.
Okay. And someone did type, as far as that incident where a parent had had trouble when they actually had a power of attorney, they said that that might be an issue for the risk management office for that facility. So they mentioned that if the parent's concerned about it, that they might reach out to the actual facility, that they need to train their staff a little bit.
Absolutely.
So that they're more aware. Right. So that was good input. Okay, I think we're almost out of time, but I do want to ask one more question. So you talked about this transition period from pediatric to young adult, but we all know that some physicians, some pediatricians continue to see adults, even though technically they're not within their frame of practice. Have you seen that be successful? As long as the patient and the physician are comfortable with that, or is there a general consensus that it's better to try to move past that?
So I think in that framework, you'd really need to figure out if the person who's seeing the individual as a child is a family medicine certified physician or a med peds, sometimes they're called. So somebody who has training in both pediatric and adult medicine is completely appropriate for the person to see. They can see them from 0 to 99. If it's truly a pediatrician who is board certified as a pediatrician, then they should not be seeing people into their adult ages. So it'd be really important to figure out how that individual provider is certified. On the nurse practitioner side of things, Julie and I are both pediatric nurse practitioners. We have been trained to deal with pediatric illnesses. I am not qualified to take care of an adult patient. It's not within my scope of practice. I have not been trained in it. And it would be inappropriate for me to do that. Now, there are family nurse practitioners who have been trained for the whole spectrum of ages. And so in that sense, they could absolutely take care of the patient into adulthood.
Okay, so it's situational and depends.
It is, yeah.
Yeah.
The one last comment I'll say is that sometimes that can turn into a bad situation, especially if you're in a larger health system and you're with a pediatrician who says, I'll take care of you. And then that young adult needs to be hospitalized, or something happens that it's not a transition anymore, it's a transfer, and it's a situation that's not planned for. It's oftentimes, I've never heard of that situation being one that people find being positive. It's oftentimes very destabilizing for both the patient as well as the family. And so as much as you might want to stick with that pediatric provider, they may get into a situation where they're not able to provide care for you. And it's also a reason to celebrate that your young adult has made it to adulthood. They through that amazing care that they've received, they've grown into an adult and are now in need of the same adult care that you and I as parents and caregivers are receiving, and we don't want to miss anything with regard to their health care.